Got our got our caffeine on deck, and we're joined here with Patrick Kroupa, the Chief Psychedelic Officer of BetterLife Pharma, and an overall pretty cool dude. Patrick, thank you for joining us and starting off the Ibogaine conference with the keynote here.
Thank you very much for having me. It's been a very long and strange trip to get to this point with Ibogaine, and it's a pleasure to be here.
Absolutely. So, how long has your journey in the Ibogaine field been? When did you originally get started?
Well, I mean, I started in the Stone Ages back in the 1990s, and I started out, the first time I ever heard of Ibogaine, I was literally a teenager, and we were at these hacker meetings that were taking place on the Lower East Side, and it was sort of the last gasp of this thing called the Technological Assistance Program, which was started by Abby Hoffman, and that was Howard Lotsoff, Dana Beal, the original crew of people who discovered sort of what Ibogaine does and the neat effects that it had. So it was always like this thing that I had heard about since I was very young. And during the 1990s, we started the first internet access provider in New York City called MindVox. And so I'm like 22 years old. Everything in my life is awesome. My dreams are coming true. Here comes .com. Here comes the internet. And I was a high-functioning addict. I was addicted to heroin the whole time. And that was a lot of fun until it wasn't. And the problem is, at that point, you discover just there's no exit. Nothing works. I had I tried literally everything. And to make a really long story very short, Ibogaine did work for me. And back in the 90s, there were fewer than 1,000 people worldwide who had ever been treated with Ibogaine, other than, indigenous people in Gabon and Cameroon who were using it as, rite of passage initiation ceremonies. They weren't using it to reset habits. And that's how I ended up working with Ibogaine during the very late 90s, early 2000s.
That's incredible. And since then, it's definitely increased in popularity, I guess you could say, or just, mass cultural adoption. How many people by now do you think have been treated by Ibogaine for similar afflictions?
It's really, really hard to say. I mean, it's, Dr. Ken Alper wrote a paper back in the 2000s, and the speed was picking up exponentially, and we're orders of magnitude. I mean, the worldwide awareness that Ibogaine exists has amplified tremendously. There's, we're like 3 generations of people past that point in time. And, Howard, who was an amazing human being, he passed away in 2010. And I think he would have been very excited because his dream was always medicalization, bringing Ibogaine to as many people as humanly possible. And that seems to be in the process of happening right now.
Beautiful. Who is your Ibogaine hero? Who's the person you look up to in the Ibogaine world, or people?
my Ibogaine hero, well, that would be Deborah Mash, because she's the single individual who, not only detoxed me, but has enabled me to save my own life. I mean, I hit a very low bottom. I was doing, I was on 200 mgs of methadone per day, and I was doing about 1.5 grams to 2 grams of heroin on top of that. It's hard to say if it's 1.5 grams or 2 grams, because there are all those quality control issues with the black market. You can't get GMP heroin, which is one of the problems with it. But I was pretty close to being dead. And, Ibogaine provides a reboot. And then, after that, I got pulled into a completely different life in a very enriched environment. And suddenly I'm at the Department of Neurology, and I'm dismantling brains and working with the human supercomputer. And it was just, okay, here's a brand new life. And it changed the path that I was on completely. So that would be Deborah, who's here with us. Yeah.
Yeah, and we're excited to have a keynote from Dr. Deborah later on today. And, really thrilled to have you here and just, an all-star cast of speakers, and really excited to get this going. So I'm not going to hog up too much time on the mic here. I really appreciate you taking the time to join us, and I'll shoo myself off backstage and let you get into the good stuff with your keynote here. Thanks so much for joining us, Patrick.
Thanks for having me, Patrick. Hey, hello. It's a pleasure to be here, albeit it's very, very early. And whoever is awake and watching all of this, it's been a very long, surreal sort of trip from the 1990s to where we're at right now in 2021. And I guess the new normal is what we're all doing right now, because usually Ibogaine conferences is, a lot of rooms with a lot of people all hanging out together, and welcome to the new reality. But as we talked about in the intro, I mean, my intersection with Ibogaine at the very beginning was as a drug dependent individual who needed help and who could not get off of opioids. I tried literally every detox methodology, every paradigm, every treatment that existed, like back in the 90s. I mean, I didn't have a lack of funding. I didn't have a lack of access to professionals. I was living in New York City. And, to compress it down and make it shorter, nothing at all worked. I was on methadone maintenance for years and years of my time. I was on methadone tapers where, you titrate down towards nothing and step out of it. I did ultra rapid opioid detox twice. It didn't accomplish much of anything. It's like, okay, you're clean, but you're clean and you feel terrible. You're just sick. And the only thing you can think about is getting straight. And so then you do. I was on the very early clinical trials for buprenorphine, where they were trying to make it bioavailable sublingually, which they succeeded with. That became Subutex and Suboxone, and that was under the auspices of Dr. Richard Resnick at Columbia. And he was actually a really phenomenal doctor. I mean, he was a good guy. There's people in addiction treatment who are just not very wonderful people. Richard Resnick was a great guy. He tried to help everybody. And, you'd go in his office and there's a signed photo of Pete Townsend, and there's Eric Clapton. He did not mount Keith Richards' photo. That was not, that didn't make him happy. But he had this thing called the TENS unit, which was like electronic acupuncture. And it was incredibly hot at that point in time during the 90s. And I tried that. That didn't work. I was basically moving outwards, trying to find different experimental treatments. And in addition to since my very early teens, I had one of those toxic childhoods that is so popular. And parts of it were a lot of fun. I mean, it was like this intersection of a lot of different worlds all colliding together. Own health issues at the time. And one of his partners named Bob Sisko turned me on to this person named Dr. Deborah Mash, who was working with Ibogaine at the University of Miami. And you're on. And as I think I summed up when this whole thing began, I was on about 200 mgs of methadone and doing, 1.5 grams to 2 grams of heroin on top of that. And So all that you're experiencing at that moment in time is pain. It feels like your bones are being smashed. It feels like your spine is being crushed in a vice. You have hot flashes, cold flashes. You feel terrible because your endogenous endorphin production is completely shut down because you keep introducing exogenous molecules into your bloodstream and attaching them to your receptors. I mean, you're going through withdrawal. And I was given Ibogaine. And what happens within about 30 to 45 minutes, it feels like, and it's very slowly coiling up your spine. And as it moves upwards, all of the pain is just letting go. And it feels like being suspended in this ocean of warm energy. And that moment right there is the closest thing I have ever experienced to a miracle, because it's like, okay, here's a sickness that I've tried to get rid of for 10 years. I mean, I've been trying to get off dope forever. Nothing ever worked. This just did. And as far as we know, this is impossible. This can't possibly be doing what it just did. And then you get really busy because you're tripping for the next 6 to 8 hours. And as you reintegrate and come back down to earth, you kind of discover that, your habit stayed lost in inner space. It didn't come back down with you. And that is absolutely phenomenal and completely unique within all of psychedelics. There's nothing else that does that. I mean, you can do LSD when you're strung out on heroin. I have many times. You can do psilocybin, you can do whatever. And you can gain the most profound insights into your addiction, your psychology. Why are you in the state that you're in right now? And as you're gliding back down to earth, unfortunately, what you discover is, habit is deception, the light is a hallucination, and your body is a prison cell because your habit is alive and well. It's still with you, and you got to go get another fix. Ibogaine non-exists your habit. And the interesting thing is, I mean, this whole story sort of started to gain momentum with Howard Lotsoff's anecdotal observations in 1962. And it would have to be a drug-dependent individual in order to make that observation, because if you aren't addicted to opiates, then you never know that it gets rid of your habit when you come back down from Ibogaine, because you don't have a habit. I mean, there's a lot of evidence that the CIA, under the auspices of Isabel Harris at the Happy Fun Lexington Narcotics Farm, was busy dosing prisoners with Ibogaine before that. And there's SIBA Pharmaceuticals, I believe went into Novartis, to the best of my knowledge. They were doing some research with Ibogaine in the 50s, and antihypertensive, but none of their findings were ever really published beyond some very early indications. So, Howard basically kicked open the gates, and Ibogaine treatment started happening during the late 70s, early 80s. By the time it was the 90s, it was kind of like shutting down, but people were getting treated on the Lower East Side of New York City. That's sort of the birthplace of Ibogaine. And, the Lower East Side is gone. If you go through all of these places in time, it's like everything has been raised and condos have gone up. It's just like it doesn't exist anymore, except in your memories and some videos on YouTube. But the really amazing thing that happened was Howard Lotsoff pushed for medicalization of Ibogaine from the very beginning. He was issued a series of patents for Ibogaine versus polysubstance abuse disorders. He formed a company. He knocked on everybody's door trying to get their attention that, hey, this works. And I think one of the only individuals that really listened to him was Dr. Deborah Mash at the University of Miami. And during the 90s, she accomplished what was essentially impossible. She got the FDA to move. The FDA green-lighted phase 1 clinical trials on Ibogaine on human drug-dependent subjects within the United States. And then eventually they kind of ground to a halt and went nowhere due to a lack of funding, because NIDA refused to fund it. At that point in time, they came back with not for further consideration. And the director there, Frank Vocci, at the time, made a very interesting statement to the press, which was, the people of America are going to think that Washington is completely off its rocker. So what all of that meant was, when we said that we wanted to, quote unquote, cure addiction and made a lot of press releases about that, we didn't want a psychedelic. This is not the answer that anybody was looking for. That was extraordinarily upsetting to the establishment back in the 90s. And the fact that Ibogaine even progressed forward in any manner whatsoever was phenomenal. And, Curtis Wright from the FDA actually wrote a personal letter to NIDA urging them to at least give it another look and move forward. The FDA was remarkably excellent about the whole thing. They had their pilot drug evaluation unit rebooted during the 90s, which is really when they began greenlighting psychedelic research. And NIDA still wouldn't do it, but it is what it is. It just never moved forward through phase 2 clinical trials, phase 3, and it never became available to drug-dependent individuals who may need it. So the original medically based Ibogaine clinic was in St. Kitts, and it was sort of a research facility, and it wasn't really tenable to continue onwards with it in that environment. It was ridiculously expensive because you had to get a bunch of clinicians, high acuity nurses, all the support staff. Everyone had to drop their lives, drop their careers, their practice, put everything on hold for 2 weeks, get on a plane and go to this island in the middle of nowhere. And that eventually shifted over to Cancun, because Cancun has a very thriving medical tourism industry. All the infrastructure that you need to safely administer Ibogaine is present. You have clinicians, you have high acuity nursing, you have the possibility of just bringing the costs down tremendously. And in one format or another, the Ibogaine clinic is sort of running Cancun since the early 2000s, and that was under the auspices of a friend of mine named Dr. Alberto Sola, who will be speaking here a little bit later. And a couple of years after that, we founded something called Clear Sky, which is a medically based, clinically managed psychedelic treatment facility. Over in 2021, everybody is talking about this. It's like, okay, we're going to administer psychedelics to people. And we've been doing that for 20 years. And it's the tricky part with Ibogaine is it's not like LSD or psilocybin. If you do too much of either one, then okay, you may have a bad trip, or you may go deeper within than you intended to. But with Ibogaine, there's a relatively narrow window between what constitutes an effective therapeutic dose and what is potentially fatal. And you need really competent medical care. You need the whole medicalized environment. It's not a good idea to do Ibogaine just sitting on a couch or something. I mean, having said that, a lot of people do and nothing bad happens to you. It's just most drug dependent individuals are not in the greatest health to begin with. They're not taking care of themselves very well, and you need monitoring. You have to be able to intervene if an adverse event occurs, because if an adverse event occurs, then you can catch it. It doesn't have to become a critical incident. And the project that's sort of, underway is like back about 3 years ago. It's been a minute. In 2018, Clear Sky kind of went into another thing called Universal Ibogaine, which is sponsoring this whole conference, I guess, and is going to be doing clinical trials, I believe, in Canada. And Canada is very strange for me as someone who's spent their whole life in America. I mean, we're kind of the evil empire in comparison to Canada. I mean, in Canada, the government just said, okay, cannabis is legal. We're going to stop with the silly bullshit and playing games. It's just been legalized. In the United States, cannabis is still a Schedule I substance, but you can legally smoke cannabis in probably like more than half to 2/3 of the United States under flat out recreational or medicinal reasons. And you can buy and sell shares of Tilray on NASDAQ, which is identical to saying you can buy and sell shares of Heroin Incorporated. It's basically theater of the absurd. Little by with where Canada is going. Health Canada was very receptive to running clinical trials on Ibogaine. Ibogaine was not a controlled or regulated substance at all in Canada. Contained Ibogaine, and people took them, and they ended up in the ER. And there was a couple of treatment clinics which were not licensed, and they had critical incidents. And critical incidents are a nice way of saying dead bodies. So Health Canada looked at all of this, and instead of responding by just banning everything, they did something remarkably enlightened. They just added it to the PDL, which is the prescription drug list. So what they did was they recognized that Ibogaine may very well have tremendous medicinal value, but it needs clinical trials to support its efficacy. Because having worked in this industry for over 20 years, subjectively and objectively, I can unequivocally state that, Ibogaine does interrupt polysubstance abuse disorders, and psychedelics just work remarkably well to address a lot of mental health issues that what big pharma is selling right now doesn't even begin to touch. But the plural of anecdotal observations is not data. We need to collect the data, run clinical trials, and be able to demonstrate what these molecules can do, and then be able to administer them in a safe environment. Over the course of all this time, I mean, at Clear Sky, we've treated a bit over 3,700 drug dependent, 3,700 treatment episodes. I mean, they're not actually individuals, because some people have gone more than once. You went 2 times, sometimes 3 times. And Ibogaine has remained remarkably consistently effective. It requires some adjustments to the treatment protocols because the drugs have changed a lot during the last 10 or 15 years. Specifically, the introduction of fentanyls has produced extraordinarily heavy habits and sort of the need to repeatedly dose people with multiple hits of Ibogaine. I mean, you can give people a flood dose, then you follow that up with another dose and another dose and another dose. And some of the materials like Subutex and Suboxone, they require, tapering down and doing a switchover protocol to a short-acting opioid. I mean, ironically enough, heroin is great. If you happen to be able to get any heroin or morphine or even oxy, and that's a very simple and smooth transition to being completely reset through Ibogaine treatment. Ibogaine has efficacy for stimulants, cocaine, methamphetamine, this entire spectrum of molecules that really don't have anything else that's an effective medication to address drug dependence. The only thing that Ibogaine does not work for are benzodiazepines. It's an inverse agonist of GABA receptors. It does absolutely nothing. I mean, when you're on Xanax, Valium, Klonopin, this entire class of molecules, Ibogaine will not address that. What is really, for me, it feels like we've spent decades sort of in this psychedelic ghetto. I mean, there's a very small group of true believers, and some of them are the PhDs and MDs. Some of them are coming at it from a more shamanistic perspective, but they all know that these molecules work. It's just this moment in time is the first time in recent history that psychedelics are being mainstreamed. All of this really exciting research, I mean, all of it was in an embryonic state, and it had kicked off during the 1950s and 1960s. And effectively, what sort of ground all research to a halt for a couple of decades was Timothy Leary. Because, I mean, Timothy Leary was the establishment. Timothy Leary went to school at West Point. He's a PhD at Harvard. And what he very clearly demonstrated is when you take psychedelic substances, all of the social programming completely washes out, and you end up with a bunch of people who are not that controllable and who may be thinking outside the box. And that scared people. And, Nixon's lasting gift to the world was that thing called the war on drugs, which is, a war on human beings. But psychedelic research ground to a halt. And there was very little happening for a long period of time. And society sort of had a perspective shift in terms of how it looks at drug-dependent individuals. People who alter their consciousness through the use of molecules are treated very poorly as a whole by society. And that's something that's pretty new. I mean, that's happened in the last couple of decades. If you go a little back further in time, there's, one example would be, William Halsted. William Halsted is considered to be one of the fathers of modern surgery. He's one of the founders of Johns Hopkins. He's also a guy who liked doing speedballs. He did cocaine and morphine and heroin for decades of his life, and quite likely performed hundreds of operations under the influence of those. There was no stigma attached to him for being a drug-dependent individual, because at the time it didn't matter. You rewind a little before that, you could buy cocaine and heroin in a Sears catalog along with your sack of potatoes. They were medicine. And at a certain point in time, different molecules become demonized. And all of this is just optics and manipulation, and how each society is sort of focused to look at all these different substances. It's extremely positive, the point in time that we're reaching right now. I mean, COVID has significantly rearranged the landscape of planet Earth. Not for the better, because everybody experiencing greater than normal stress levels. Everyone's day is filled with a lot of problems they didn't have a year and a half ago. Everybody's isolated. Everybody is sitting by themselves somewhere. And psychedelics are kind of like moving forward at a very dramatic rate, and they're picking up speed, and people are starting to recognize their value towards addressing an extremely wide variety of issues that are not really addressed by anything else. It's a great moment in time, and I think Howard would be very, very thrilled that we're all here. So the whole question with Ibogaine is, establishing reasonable safety protocols for how to administer it and how to utilize it. I think most of us who have been working with it for a very long time have a very clear idea of how to do that. In order to move it forward through the whole medicalization process, it's going to take years of time and a tremendous amount of funding to actualize the goal of enabling Ibogaine accessibility for drug-dependent individuals who need it. Ibogaine actually does. It's been termed then a neurogen, which means a dream-inducing substance, which is not far wrong. I mean, if you do a lot of LSD and you open your eyes, then nothing really changes. You're still there. It's not going to bring you down out of it. I mean, if you're doing a very high dose of Ibogaine and you open your eyes, you look around, it kind of like recedes out and it fades away. Ibogaine has very low affinity at 5-HT2A, which is like the receptor where most classical psychedelics attach themselves to. And, over here in 2021, we still don't know the mechanism of action. We still don't know why it works. It's an extraordinarily complicated, dirty molecule. And by dirty molecule, I mean, it has high affinity for multiple receptor sites. I mean, binding is basically a hyperbolic curve. I mean, it moves upwards. The higher you dose people with, the more saturation you get, and it's acting within the spectrum of a very large series of interlocking systems. And there's the possibility that somewhere in the future we're going to wind up with different designer molecules, as in variants of Ibogaine. I mean, ostensibly 18MC is called second generation Ibogaine. 18MC has been around for all eternity. I mean, at least since the late 90s, early 2000s. The molecule was actually designed by Martin Kuhn, who has since aged out and passed away, and Stanley Glick sort of brought it forward. It ostensibly alleviates that whole tripping out part, which makes it more difficult to medicalize, while retaining some of the benefits or most of the benefits of Ibogaine. That actually remains to be seen. There's a variety of other second or third generation molecules, depending on how you want to look at them, which all reputedly create the same sort of reset from polysubstance abuse disorders as Ibogaine. They're attempting to obviate the psychedelic and tripping out part and just keep the anti-addiction part. And most of all, they want to get rid of any hERG inhibition, which is anywhere where Ibogaine interacts with your heart and causes prolonged QT intervals, which is not good. I mean, that's the part where you need the medical monitoring. And I have faith that all of these different pathways will move forward in their own way. Ibogaine is absolutely unique for what it does for physical dependence and drug-dependent individuals. There is no other psychedelic drug that can do what Ibogaine does. Post-Ibogaine, there are a variety of molecules which can help you maintain and adjust your headspace. And just speaking from personal experience and those anecdotal observations, LSD is remarkably useful for maintaining a positive headspace, sort of readjusting where your focus is, resetting a lot of the symptomology associated with bipolar or major depressive disorder. It helps. And there seems to be an entire wave of new paradigms which are fusing together the possibility of psychedelic drugs, technology and software that's evolving and sort of bringing about a new healthcare paradigm, which is desperately needed. It's addictionology has not really progressed very far. I mean, when I first was being treated for drug dependence, I mean, my response to this was like, are you kidding? This is it. I mean, this is like going to a religious class. You're in a 12-step meeting. You're labeled yourself as an addict. You're diseased. You're flawed. It's just, no, thank you. I have enough problems. I don't need an imaginary disease. How about you are whole? You're complete. You're a human being. You've taken whatever path through life that you have, and maybe you can make different choices. And after you do psychedelics, yes, you can, because they re-engage neuroplasticity. Your brain remodels itself and you move forward on your journey. And that isn't to say that, drugs have nothing to teach you, even hard drugs. I mean, heroin, people look at addiction and they look at people who are in active addiction. It's just like, why do you do this to yourself? Well, one answer is, I can't stop. It's not that easy. You can't think your way out of addiction. I mean, another well-known addict was, that guy Freud, who's sort of the foundation for modern psychotherapy. I think we've all moved past that a bit, more towards one of his pupils, Jung. But he wrote endless papers about why cocaine is addictive, but it's all right for him to do it. I mean, okay, we call that denial, but thanks for sharing. It was really, really interesting. But the whole process of learning what you get from drugs. I mean, what is it that opioids actually give you? The answer is they give you complete contentment. They give you peace. They give you a total lack of pain. What is it that you really want out of life? I'd like to feel exactly like this forever. That's it. That's all I want. Okay, so how do you find a way to compete with that in reality by having a life? How do you re-engage and pull yourself back in? Because everybody has all these things that you think that you want. You want this career, this job, this girl, this guy, the house, the car, whatever it is that you think you want that's going to make you happy. It very well might. That's up to you. But all of it is an illusion, because the only thing that the supercomputer that's floating around inside your skull actually cares about is dopamine and serotonin. That's it. Everything else is just whatever story you're telling yourself, whatever programming you have. So all of these are different life lessons, and I believe that all experience is sacred because it's brought you to this point that you're at right now. And it's given you a tremendous body of experience if you choose to accept it and integrate it within who and what you are. If you are a drug dependent individual, then all you need to do is believe, rewrite your own mythology, write a script that you want. Who do you want to become? Act as if and become. It's really that simple. Psychedelics allow you to do that by making some fundamental changes in your neurochemistry and re-engaging neuroplasticity. So your brain is physically remodeling itself. And over here in again, 2021 is pretty fantastic because all of this is reemerging in a very rational and reasonable manner where both medicalization and decriminalization are occurring sort of simultaneously. I mean, decriminalization, it's piece by piece, and this jurisdiction, that jurisdiction, but it's happening. The war on drugs is kind of grinding to a halt. I think that, every single drug initiative that was on any ballot in 2020, all of them won. I mean, I believe that it's safe to say that after a very long and epic struggle, drugs have won the war on drugs, which is fantastic. Because I honestly believe we're going to look back at this period of time that came before us. It's just very barbaric to criminalize a medical condition and imprison people for what? For altering their state of consciousness against the government's wishes. You're attaching molecules to your receptors. That's crazy. That doesn't make any sense whatsoever. There's a complete disconnect between medicine, science, and I greatly appreciate the opportunity to sort of open the Ibogaine conversation, which looks like it's going to run for 24 hours straight or 12 hours straight, followed by another 12 hours on the next day. And the planet Earth will hear about a lot of Ibogaine.
It's going to be a marathon, that's for certain.
Hello, Patrick.
We have a couple questions here from the audience, Patrick, so I'll get into them with you if that's all right. So from Vitor, he's asking, has it already been tested, the administration of Ibogaine with CBD for addiction treatments?
I'm not aware of any specific studies that combine Ibogaine with CBD. I know people have already filed patents on it because people file patents on almost everything, Ibogaine plus this, that, and we've kind of gone to the same place with BetterLife, and you've got Microdose, who's I mean, CBD is actually, I can tell you anecdotally what you already know, it's effective for attenuating benzodiazepine. I'm not personally aware of any studies that concomitantly combine Ibogaine with CBD.
Fantastic. From Adam Deborah, why the 4 months in Wat Tam Krabak if Ibogaine was so quick?
Okay, you're reading up on me. I didn't even mention that. The 4 months in Tam, basically, I was completely burnt out on addiction treatment. And, the 12 steps, all that material, because I'm using my grown-up language there. All right, let me comp one of their cliches. I took what I found useful and got rid of the rest. And, one of their big things is misquoting, I believe, Einstein, which is a reasonable definition of insanity is repeating the same thing over and over again and expecting different results. So I'd been to rehab. I'd been through 30, 35 different detoxes, more than that over the years. And rehab, I'd done probably 12, 15, and they never did anything for me. So I'm clean, I'm reset. But the reality is, Ibogaine will give you the reset. You still need aftercare, some form of aftercare. You need to change your life. Ibogaine does not come with a magic force field that keeps the drugs away from you. It will not hand you a brand new life. You have to do that. And I went to Thailand to live in a monastery or a wat, as they're called there. And I lived there for 4 months. And it was really beautiful. I mean, I was surrounded by completely non-judgmental people. They're all Buddhists. They don't really understand the concept of Western models of therapy. And it's like, okay, what do you guys do? It's like, well, they ask you, what are your feelings and what are your thoughts? And their response to that was like, why? What does that accomplish? That's a really good question. I don't know. Maybe if you keep digging in shit, you'll be covered in it. I don't know. Western models of mind are remarkably helpful for isolating a near endless collection of things that are wrong with you. But I've also found they're almost useless in terms of solving any of it. This is where psychedelics come in and actually affect change and allow people to move onwards.
Beautiful. A follow-up from Adam. Separately, does Ibogaine have any potential psychiatric applications outside of addressing certain addictions?
That's a whole psychospiritual question. And, there are multiple entities studying it for PTSD, where it appears to have efficacy. It does appear to have efficacy for multiple psychiatric conditions and co-occurring disorders, which certainly many drug-dependent individuals are self-medicating. Having said that, though, Ibogaine is one of the more dangerous psychedelics in the sense that it can kill you. I mean, you can do some, LSD, you can do some ecstasy, you can do psilocybin. None of these things are going to kill you, and they all provide some sort of psychospiritual benefit. So it's weighing the risk versus benefit ratio, really. And there's no way for me to make a blanket statement about that. That would be dependent on every individual.
Fair enough. Another question from Dr. Keaton Patel, another pretty cool dude. What is the pre-work and titration protocol required before Ibogaine administration?
Well, I mean, the pre-work is, all right, you're 100% of your clients are drug-dependent individuals. So you can work under the assumption that almost everything you know about them is wrong, because there's whatever the patient has chosen to self-disclose, there is whatever their clinicians tell you, there is whatever their significant other or management or handlers have told you, and then there's what finally walks through the door to be treated. And often that has absolutely nothing in common with what information you've been given. So essentially the protocol is you take control of that person's drug supply. So you have nursing staff who's actually dispensing their medication. What doses are they versus what doses they said they were on? What drugs are they actually taking? What's their blood work? How are they doing? Essentially, it's just stabilizing people, seeing what we really have to work with, and then figuring out the protocol to move forward. At Clear Sky, anyway, the hard one to work with is like Subutex and Suboxone, because it's an agonist antagonist with a very long half-life. So you have to do a switch over to, we use morphine, because morphine is really clean, very fast, easy to work with. And that is, again, dependent on the individual. So basically, you're looking at least 8 days downtime. If you're on a long-acting opioid, it's more like 2 weeks. And you've got to do some work before Ibogaine. You need to taper down slightly. I mean, there are people who are on crazy high doses that it's just not immediately treatable. You have to come downwards before, doing the switch over protocol and doing Ibogaine.
Fantastic. So I think that's it for the Q&A for now, and we're running into time on the session here. So really appreciate your insights. That was a fantastic opening keynote. I'm just gonna go ahead and hide myself from the stage and leave you to say some final words, and then we'll move back over into reception and get ready for the next panel. Thanks so much, Patrick.
Thank you. All right, thanks very much. And I just want to welcome everybody who is new to this or has interest in this to the Ibogaine conference. I see a lot of remarkable individuals I've had the pleasure of knowing for decades of time who are participating. And I think it's going to cover a lot of different aspects of Ibogaine treatment and enable a far greater understanding of where we're at in terms of medicalizing it and making it accessible to everyone. And thank you very much for attending. And I wish you a very exciting 2 days in the Ibogaine conference.